high time we protect ourselves, protect the patients, and then go ahead with our lives. Because Corona, as we all know, is not leaving us today, it's not leaving us tomorrow.
COVID-19 is here with us. Technology has aided the instant transmission of texts, pictures, and videos to afford every inch of the world the opportunity to be abreast with what is going on. Governments, health workers, security councils, and civil society organizations across the globe have employed various measures to manage the situation. In Ghana, health facilities and most public places have adopted strict screening mechanisms to ensure that the virus spread is reduced to the barest minimum. The Northern Region Eye Health Service project, supported by the Swiss Red Cross, is one project that is leaving no stone unturned in ensuring higher standards of preventive and protective care.
We make sure that anybody at all who comes into the hospital will have to wear a face mask before. The operation is no face mask, no entry. And we have placed the buckets with soap, all at the vantage areas at the entrance of each ward. Everyone who is entering there or coming out wash their hands with soap and water.
The Swiss Red Cross project builds on past experiences to strengthen their work. The project was already run on a strong infection prevention and control protocols.
Swiss Red Cross actually introduced some biosafety mechanisms that we actually practice in the theater as we go through surgeries. But because of COVID, now we've been practicing since then. But because of COVID, we have to intensify most of the things that we do in order to make sure that we don't introduce any infection into anybody's eye and even get to a point of spoiling someone's eye.
With the eye surgeries, mostly we normally invite more. But this time, because of the COVID, we have restricted the number. And then apart from that, we have placed plastic chairs all over, and then we've made sure that distance, the 1 meter distance, is observed properly. We make sure that all of them, the patients who are to undergo surgery, are in face masks. Even on the operation table, they are supposed to be on face masks.
It was, however, important that the protocols were adapted to the prevailing situation that required some extra efforts and investments.
I'm wearing a head gear to cover my head. This is a face shield. I'm wearing my face mask to protect droplets from myself to the patient and also protect the patient from getting to me. And I'm wearing my overall PPE that protects me from all kinds of things. There's also a third one to ensure that we don't contaminate the trolley or also contaminate the patient or ourselves.
We think that the program has been very swift in coming to our aid with these protective equipment that we requested for. For this short period of time that we had to break, we've had accumulation of patients, and the last record I had was 1,067 patients.
In Ghana, COVID-19 is silent and found in communities and not health facilities. Most of the confirmed cases had to be hunted down to their communities, with just a handful of them self-reporting as OPD cases. This makes community work very important, and the Red Cross is on top of this.
This time, because of the COVID, the Red Cross volunteers had to move into the communities to educate our clients who are coming for the surgery on hand washing, and also give them the face mask in the community and tell them what they are expected to do in the hospital when they come, so that when they get in here, they will not do things that they are not supposed to do. So we see that when the patients even came in, we never had any problem with them as compared to those who are coming to the general side, because they have not had that prior education.
The Red Cross has adopted a strategy of merging their eye work with education on COVID and how to observe certain positive practices. At the end of the day, all the Red Cross in Ghana looks for is a protective community and knowledgeable citizens with a positive attitude towards the pandemic.
Our visit to this community
And for that matter, this particular house indicates that this house is now COVID-19 conscious house. All the inhabitants here have been conscientized about COVID-19, and it's through eye care we are able to do this for other members who are in this particular house.
At programming level, all efforts have been consolidated to make a bigger impact.
The Mothers Club volunteers or Mother Club members work mostly with the women at the home level. So at the home level, they try to give information on COVID that will help them, the women, prevent the transmission of the disease at the home level. Then with regards to the eye health volunteers who are dotted widely across the regions, they are more promotive. So they inform community members about the facts about COVID-19. And with regard to the DRR volunteers, the CDPRT, they are more responsive.
In all these, there is the need for knowledge sharing among peers and partners.
With all these programs scattered across the globe, I would like to request that there should be regular consultation, regular meetings, regular discussions among the doctors and the other technical persons like the ophthalmic nurses. They are very important in bringing out certain ideas that can move the program forward.